Good afternoon. This is Dr.Nanteza talking to you about self-medication. Self-medication is a common habit and it's a very common act where many of us go. If you feel a little bit sick or uncomfortable, you go and look for a substance that is going to help relieve or heal your sickness or disease. Without advice from a consultant, advice from a healthcare provider, advice from a physician or a doctor. It has a lot of good, though it also has the bad. For the good, it helps us. Sometimes when you have minor illnesses, it's good. It helps the healthcare system not to avoid or eliminate the delays that come with self-medication. For example, if someone or a child has cough, they have flu, they have a cold, a parent may think of going to the hospital and then they're making those long lines to see someone, to see a consultant, to see a physician. And then at the end of the day, they're going to give them the medication they could access from home. So it can help us to relieve or to eliminate all those delays that can come with advice and consultation from healthcare givers. However, sometimes it also has the bad. There are very many bad. I'm going to give you about 9 to 10 disadvantages of self-medication. And by self-medication, I do not mean only the drugs. You can get drugs without advice from a healthcare giver, but then I'm also talking about the herbs. We also have the local remedies we make at home. For example, I think in this COVID period, many of us have witnessed this. A lot of people have stayed home and they have made local remedies, they have made herbs to heal what they thought was COVID. And after the COVID wave has elapsed, we are receiving patients or we are receiving people coming in and they're complaining, I've been treating COVID or I've self-treated myself. At the end of the day, they're having something totally different. So today we are going to talk about the bad that is involved in self-medication, medicating or treating yourself without advice from an expert caregiver. One, we usually have misdiagnosis. You can think, because I'm coughing or because of a headache or because of a fever, I'm having malaria. At the end of the day, you treat malaria. By the time they bring you in a hospital or they bring you to a health center, we are finding very, very different diagnoses. So, number one bad, you're going to misdiagnose yourself if you do not get advice from the experts. And misdiagnosing yourself comes with number two. You're going to misuse drugs. For example, you're having a fever, you feel like, oh, this is the fever I've always had. Even last year when I had this fever, I had malaria. At the end of the day, you're going to treat malaria with coatam from wherever you're going to get, or you will treat with herbs. By the time you come and seek advice or you seek help, you are treating something very different. You are treating typhoid with coatam. So we have misuse of drugs. Number three, we can have prolonged duration of medication or treatment. Sometimes you feel like, oh, I have this headache, and every time I have this headache, I take this drug. So you're going to keep treating for a longer duration. These medications or tablets or whatever, even herbs, they're supposed to be taken for a certain duration. But you find someone taking a herb for a very long time. They did not get advice from someone who is an expert. They thought they could handle on their own. Number four, we can have drug interactions. These drugs, when they were being made pharmacologically, they mimic some components, sometimes in our bodies, sometimes of the organisms that affect us. And you're going to find the organs which are supposed to eliminate these components, or the components of these drugs you're taking, are supposed to have a limit. So if you keep on mixing drugs, today you're having headache, you're going to self-medicate. Then tomorrow you're having stomach ache, you're going to go and look for a given tablet or a given drug or a given remedy. You may end up interacting or having drug interactions. Another point, there is delay in seeking medical help. There are a lot of people who come in at the verge of death, and this is because they delayed to come. You keep on medicating. Okay, someone comes in with a child and they're telling you, how long have they been sick? They've been having cough for 3 weeks. And you were seated at home, what were you doing? Okay, we first gave cough syrup, then we went and some neighbor prescribed this, and then the child has something very, very, very different or something very worse. A lot of people come in and we as doctors, we do not have anything to do. The only thing we can tell them is we've really done our best. And that is because they came in late. Self-medication can make you delay to receive a diagnosis which could have been solved. Then we also have adverse reactions. They usually say where there is good, there is also bad. Anything or too much of anything can have disadvantages. So that's the same thing here. Sometimes these drugs, or most of the times, they have adverse reactions. And since you do not know about how this drug was formed, or you're not an expert in this, you will take the drug, sometimes you'll get the adverse reactions and you will never know what's happening. Some of them come in with adverse reactions or even complications due to the drugs, and you're wondering what happened. And this person did not even know that a drug of this kind can develop into this or can bring this about. Yes, some other times you can mask a disease. There are a lot of times you're having, or you're thinking this is just a slight cough, and then you keep on treating with cough syrups, you know, yet you're treating symptoms, you're masking a severe disease. So you notice a lot of patients come in when they're having, the disease is way out of control, and sometimes you do not have what to do. Sometimes we are now dealing with complications. And it is all because they were self-medicating, treating a symptom. For example, someone can be treating cough, and today you're complaining, oh, this child has cough. By the time you come to a hospital, these people are having heart failure and they're failing. It's because you've been managing symptoms. You do not know the underlying cause. You did not get a diagnosis. So you can easily mask the disease. We also have risk of dependency and abuse. And that is going to be my last point. This is very common among the youth, especially the youth who are living with chronic illnesses. The youth sometimes living with sickle cell disease. Since, you know, for me, I usually get this kind of drug at this kind of time. So you keep on getting it for yourself without advice. At a certain point, you're going to develop dependency of that drug. And we've had these cases. A child comes in because they've been feeding on morphine and it has been helping them. They are no longer needing them for their symptoms, but they need them because they're now dependent on the drugs. That is very bad, because at the end of the day, if you find out that this is the maximum we can offer, we will not be able to help you when you really need that thing because you've been dependent on it. Yes. So self-medication is important, but if you want to have a better life, if you want to live our lives better, we really need at some point to seek for medical help. We have to make it our habit to always seek for medical help, even when it's not worse, to seek for advice. You may not necessarily get the drug from the health center or from a healthcare giver, but seek for advice. Tell them, go there just to consult. I have this, I think I'm having this, what should I do? Then when you try to self-medicate, if you try time once, and it's not working, please seek for help. Let's avoid to overstay at home, and we are self-medicating and we are not coming out for help. Thank you.